All right, we'll get started for the sake of time. As a reminder, today's webinar will be recorded. My name is Emily. I'm the education specialist with Selectpath Benefits and Financial, and I'm excited to introduce our first Exemplify video of the year. That being said, we are joined by the Kicks Care team. We're joined by Adam and Irma and our speaker Ashton today. Ashton specifically has over 14 years of experience as a registered nurse and has dedicated her career to advancing pediatric care in a variety of clinical settings. This includes the renowned SickKids Hospital Emergency Department and the Children's Aid Society of Toronto. We're especially excited to have her. She's also a mother of two. She brings a very unique perspective to her role in understanding firsthand the challenges that families are facing when navigating the healthcare systems. She is currently serving as the Director of Clinical Services and is committed to optimizing children's health and wellness through compassionate, evidence-based care. So today's presentation will really dive into the critical issue of the state of pediatric mental health in Canada, exploring its profound effects on children and families. We are so excited to be able to have the Kicks Care team. That being said, if there's any questions that come up throughout the presentation, feel free. You'll have access to the chat function, and there will absolutely be time at the end. So without further ado, thank you again, Kicks Care team, and I'll pass the mic off.
Thank you for the warm welcome. So I'm excited to be here today to talk about the impacts of pediatric mental health on children and families across Canada. So I don't need to introduce myself because that was such a nice, welcoming introduction. My team is here, and I'm happy to give you some insight on what's happening, specifically related to pediatric mental health and how it doesn't just impact the child, but it impacts the entire family that is a part of this child's life, and in turn also impacts businesses and employers because the parents are the ones that are working, but they're not present because they're dealing with home issues and concerns. So next slide. So pediatric mental health really refers to the emotional, the psychological, and the social well-being of a child or adolescent. It's not just a child may have a concern such as ADHD or anxiety, but a child may have challenges regulating their emotions, or they may have formal diagnoses. But the reality is that mental health plays a critical role in children's ability to learn, to form relationships, and to navigate life challenges. And we need to be proactive because any adverse events that happen specifically in that 0 to 5 really does impact a child's well-being in terms of their ability to learn at school, to form positive relationships, and to be resilient when things aren't going so well. So we need to be able to teach them coping mechanisms and strategies. And that foundation of education comes from their parents and their caregivers, as well as their influences that are maybe at daycares and schools and other settings that a child may be implemented into. And so we really do need to be proactive versus reactive. And right now, our healthcare system is very reactive. There was a problem and we want to try to fix it instead of going, let's teach the foundation early so that these adverse events and these children are empowered and these parents are empowered with how to really raise healthy children, both mentally and physically, focusing specifically on mental health. And so this presentation is really going to explore where we currently are at in the mental health system in Canada and the impacts that it has on children and families. Next slide, please. So the prevalence is really high. So 1 in 5 children or youth in Canada experience a mental health concern. So when you're thinking about that in your family networks, maybe you have a couple children and so does one of your brothers or sisters or friends, 1 in 5, that is significant. And so when you look around in a classroom or your setting, your workplace setting, many of these families are experiencing some sort of impact related to their child's mental health. And these concerns can range in severity, and it can include things like anxiety, depression, ADHD, and behavioral concerns. And mental health challenges really start emerging and are present in early childhood, with 50% of these illnesses being diagnosed before the age of 14. So think about the communication level that a child under the age of 14 has and their understanding of what's maybe happening. Versus when they're 14, they may be able to express themselves a little bit more or speak to what they're experiencing or feeling, where children don't have that same ability or can recognize maybe why they're behaving a specific way. So it is really important that businesses and employers and parents are empowered to deliver knowledge in advance so that we are able to recognize when something is starting to go wrong, when something is going wrong, so that we can implement change long in advance, so we aren't in this crisis moment where a child is in such crisis that they can't attend school or they can't leave their bedroom. We can really start being proactive about it so that the impacts and the lifelong impacts are significantly reduced. And so early intervention is really critical in managing and mitigating long-term effects of the overall well-being of the development of this child, their mental health severity, and the impacts that it has on caregivers, as well as other siblings in the home or who else is part of their family network. And then in turn, also employers and businesses, because they will have present workers that aren't having to deal with the impacts at home of children that are struggling with mental health. And so factors that contribute to pediatric mental health can be very genetic. So we do know that when there is a family history of formal diagnosed mental health, whether that may be ADHD or depression, or even severe mental health disorders like bipolar or schizophrenia, there is a very strong genetic factor that other people in the family, such as their children, will be diagnosed and exhibit signs and symptoms early on. So we should be mindful of that. In our immediate family, and then just a bit down into cousins and aunties and uncles, because that could be a very good indicator that we may need to put in supports in advance, because there is a strong likelihood if a child is starting to show some early signs. And in pediatrics, we don't like to diagnose or label a child in advance. There is a lot of stigma around mental health for sure. But the reality is that children are going through developmentally and emotional stages so different. And there's many different factors that can affect how a child is developing. And so if we put on these labels and diagnoses too early, that could be really at a detriment to this child. And so, and at the end of the day, our interventions are coping and therapy, and first line of defense is not medication in pediatrics. Obviously, when that's needed, we will, but it really is starting to educate the families, educate the child, provide therapy, and their schools and or daycare settings of how to take care of this child and provide them with the best opportunity based on what concerns are being presented. We know that environmental factors have a huge impact in children, and their socioeconomic status, as well as poverty, has a huge impact. And that's because, do they have proper and safe housing? Some families are living in shelters. There are children that are being raised on the streets. There are children that are being raised in environments and neighborhoods that have increased violence, increased exposure to substance misuse. There is children that experience trauma from loss of a parent in a specific way that could be very traumatic, or or also they could be abused, whether that is emotionally or physically or sexually. And we know, as I said, adverse childhood events that happen between the ages of 0 to 5, especially ones that don't have the right therapy and support to work through and navigate what they've experienced, have long lasting impacts. Stress hormone is released in a child when they are exposed to these environments. They're always in kind of that I'm ready to be prepared for something to go wrong. And so when they're in this state, they're always having stress on their body and stress on their brains. They release cortisol, which affects their brain and their brain development. And so there is significant impact when children have these unfortunate environments to be raised in. And the other thing is that maybe there's not consistency around going to school or supervision. You know, some children may feel like they don't have the opportunity to go to post-secondary school, so why should they apply themselves now? Because financially they'll never be able to. So they turn to different avenues to make money that maybe aren't the best choices in life. They also have those peer pressures to join certain communities and gangs, and because they feel loved and welcomed, where maybe they don't feel that at home. And food is huge to have proper growth and development. And so when we can't afford proper healthy food, this child isn't necessarily growing, and they're also more at risk for health concerns. And so environmental factors and poverty have a huge level of effect on a child's well-being and mental health. And these social pressures too, we have peer pressure to be somebody that we are maybe not, or to stand out, especially in specific communities. We have bullying that happens at a young age. You know, it's learned at home. It's also brought to the school. And, you know, it also follows these children. They're so connected to technology now. In the schools, they're using technology. They get technology at home. Technology impacts them because it follows them. So maybe when we were younger, we got bullied at school, and when we left school, we could come home and it didn't follow us. But now there is social media that follows these children, that keeps bullying going even when they're not at school. They're also being able to access things that maybe aren't age appropriate. And so they're learning ways to cause harm to others, or are feeling those peer influences and pressures at home, when traditionally years ago they didn't have that. And electronic use is high in children and really should be limited. But children are playing video games that are violent, that are exposing them to elements of crime and sex trafficking. Children are being sex trafficked because these predators are able to access them through social media accounts that seem so innocent, but they aren't. And then also just children are, in terms of mental health, one of the things that families and parents forget is that TVs and electronics are flashy. There's lots happening. And so young children under the age of 2 should have 0 screen time at all, because it is too much going on for the brain, and overuse of this screen can increase the risk of ADHD. We see behavioral issues when we try to remove electronics from children, because they're so fixated on it, because it's meant to give them highs and lows and everything in between. And it also is meant to give them these emotions of feeling like I'm happy, I'm entertained, and then they don't know how to entertain themselves outside of that. So all of these factors aren't common sense for parents to really know, which is why being able to, as a healthcare provider, to educate people like yourself and families to know the importance of mental health and how to parent our children is so important to helping break some of these cycles that are really quite easy to break. And some of it is just eliminating access, or being mindful of exposure to different elements of social media or certain video games, or having these conversations early with your children to talk about safety and what may be influencing them and why, and allowing them to have a place to feel comfortable to come to you and talk to you about what's going on and what they may be feeling. Next slide, please. So there is a variety of mental health disorders in children, but some of the common ones are anxiety. Anxiety can range from, my child doesn't do well with change in routine, and that doesn't mean we need to give them a formal diagnosis. That just means we need to say, back to school or summer or, holidays could create anxiety in this child. And we just need to learn how to maybe make a calendar or set timers or find ways to make them excited or less nervous about certain changes that happen. So getting out the door for school may be very anxious for one child. And so maybe we need to make sure that we're not rushed and we give them 10 extra minutes so that if their anxiety levels up, we aren't contributing that because we are saying, get out the door, hurry up, we're going to be late. And so it's thinking about things like that. But there are children that have social anxiety that need support or separation anxiety from one parent or a caregiver when they need to go to work, or a formal diagnosis of generalized anxiety disorders because, these aren't things that have improved in the proactive stage of when they're young and have got to more of a severe point. And that's the same with the depression. We are seeing an increased rate of depression in young children, and that is impacting them not only to go out and be social with their friends, they are really being withdrawn. They have self-harming techniques such as cutting. There's suicidal ideations and thoughts in children at a very young age, 8, 9 years old. And this is really impacting their academics. And the more that they withdraw, the more depressed they get. And so we need to find ways to kind of start pushing them to get out so that they can start feeling good about that again. And again, the more that we are proactive about mental health, the less we are in this reactive stage managing these severe signs of depression. And we also catch it early so that we can put in these safety mechanisms before a child decides to start thinking and turning to self-harming and withdrawing from social events and activities and family, or maybe thinking about having suicidal ideations or an active plan that results in suicide. ADHD, and lots of people are very aware of that. And, again, some of this is genetic, but other times this is exposure to overuse of electronics. And so these children really do struggle, not only in the home, but in the academic settings because they need to sit down and focus. But what is important is that if we recognize these signs and symptoms, we can make settings such as school a great place for them by implementing maybe breaks for them when there's long periods of sitting down, or working with an OT, an occupational therapist, to say, there's really great bands now that can go around chairs so that a child can be sitting but bouncing their legs off to keep their body moving because that's what they need, or those fidget toys. So creating successful strategies when they're in certain settings that are more challenging for them is important. And that starts with recognizing what's going on, educating the parents, providing them access to the right care providers to help implement strategies and coping mechanisms throughout the entire setting that the child is going to be in. And we're all aware of autism. So autism really does have a spectrum. And so some children are more severe than others in terms of their diagnosis, but being proactive, not only being able to diagnose or recognize early signs and then getting that diagnosis so that we can get that funding for these families so that therapy can happen, because therapy is not always affordable. And we know that affordability to mental health practitioners is a barrier in them accessing the right providers to support them and their children. So when they're connected or have access to people like myself who are nurses or other healthcare providers, it really is important because we can help them navigate this system. It's very complex. We know that. When do I go to an urgent care versus a walk-in clinic? And my experience over the years working in Emerge at SickKids, we have families coming in crisis going, I don't know what to do. But unfortunately, the emergency department is not the spot to help them. And all we do is make a referral and send them on their way, because we are there for emergency medicine more so than mental health. And the referral time and wait time is significant in the communities. Families have lack of access to primary care providers. Primary care providers aren't necessarily comfortable to recognize pediatric mental health illnesses, so they're not being diagnosed or being flagged early on to help when there is developmental concerns that happen at an early age, such as 18 months, 2 years, 3 years old. And so we really do need to have pediatric specialists, and that's why I'm fortunate to have focused my career in pediatrics and work in an organization that's what we do. All of our providers are comfortable with that, and we really do need providers and programs like this to help parents really streamline and navigate through and get to the right experts as fast as possible to start this care. And that even comes down to eating disorders. We've seen a rise in eating disorders during the pandemic, and that was just because it was highlighted. The pandemic highlighted mental health in pediatrics. It was well known in the pediatric world that mental health was underfunded and under-resourced, but what COVID did was show how much isolation and lack of social abilities for children to get out and do things, how it affects them, and how our system hasn't set up to be focused on providing this care in a timely manner that's accessible regardless of where you live, because maybe somebody's fortunate to be in Toronto or be in London or Montreal or close to these Ottawa, these large pediatric facilities, but there's many people that aren't close, which means they don't have the same access to pediatric providers. And so what it did was allow virtual medicine to start coming in and really showing how it can help accessibility and affordability of mental health support. Next slide, please. So the impact on families is significant because there's that emotional toll of being stressed and having anxiety by the parent and whoever else is a caregiver. We know that family networks look different. Sometimes there is grandma, grandpa, and the parents. Sometimes it is just the grandparents. Maybe it is foster parents, but they are impacted because they feel helpless. There's feelings of guilt and shame. What did I do wrong? What did I not provide for my child? Or did I over provide for my child? Why didn't I recognize signs early, especially when it is 14 or older and these children said, well, I've been feeling this way for the last 5 years and you never noticed. And how a parent is able to apply themselves with all of that guilt and feeling of helplessness and shame at work, it significantly impacts them because it starts impacting their own mental health and well-being. And obviously they're more focused on trying to support their child where there are less resources. And so they're not even supporting themselves. And then they're trying to perform at their job. There's this financial burden of cost for treatment. Can I afford it? And many businesses are doing their part by putting great mental health benefits and supports into benefits packages. And so some families are fortunate enough to have access to that, but they forget how to use it or what practitioner. So for example, I see a lot of, I need a psychologist. And I say, well, why do you need a psychologist? This child has not even started to have therapy. So let's maybe start with a psychotherapist or a social worker that has just as many coping strategies and techniques and experience as a psychologist. And then maybe if that is not successful, or we need some of these very formal diagnoses to put in certain IEPs at school, that's when we can bring in a psychologist or a pediatrician or a specialized mental health practitioner. But before that, maybe we use a board certified behavioral analyst to look at executive function and social skills. And we work with a social worker to work with them on the therapy side of things to be building up their, how they see themselves and how they cope through different adverse events or stressors in their lives. And so even though there is financial burden, and we know that because that is one of the number one complaints of families is I can't afford it. A lot of times they don't even know how to navigate their benefits. So speaking to them and being able to say, let's use this line because we can use so much more of your benefits, or putting in healthcare spending and not capping EAPs, or putting in wellness accounts so that they can put it to the provider that makes sense for this child and that allows them to have continuity of care with the same practitioner, so they don't have to start with one and then stop and then restart again because there's a cap, is really crucial to the success of this child's mental health. And virtual allows families, as I said, to access this care regardless of where they are, and access the level of pediatric care regardless of where they are. Family dynamics obviously matter. There can be relationships where there are divorced parents that maybe one parent agrees in a therapy and the other doesn't. There obviously can be stressors within homes or separated couples where it is impacting decision making for this child and for this parent to be performing as a parent as well as at work. Sometimes they forget how their stress and their anxiety or what they're exposing their child to is a detriment or affects their child's mental health. A lot of times, families forget that a child, even as an infant, is impacted when they're hearing yelling and screaming and fighting. And so, but this is all stressors that families are constantly under as their family network, and then also what they bring to work and how it affects them in their ability to perform there as well. The impact on employers is significant, and 53% of parents have missed work due to their child's mental health and trying to access care or making sure their child is safe and supervised at home. And 50% of working parents think about their child's mental health while at work. And 6 days of work are missed each year by a parent with a young child managing their child care and compared to their colleagues. And moms are impacted more so because they are typically the caregiver that is managing all of these issues at home. And approximately 421 million per year is lost in productivity by businesses in Ontario alone due to parents missing work to care for their children with things such as anxiety and other mental health disorders. So it's a significant impact all around when this is presented in a family's life. Next slide. And barriers to mental health, again, as I mentioned, is the stigma. So there is a culture and a social stigma that goes around that. So some cultural beliefs feel like maybe they can't talk about certain things, especially when we're thinking about where maybe a child is struggling with gender and sexual identity issues. There's also depending on what social status, parents are scared to tell their friends and family what's going on with the child because they're worried about judgment. And the reality is that when that happens, care isn't actually started because they just sit there and hide it all. But then we are getting to the point where a child and a family is now in crisis. We're trying to support that crisis moment versus being proactive. So the more that we talk about mental health and normalize it, every single one of you here today have mental health. We all have good days and we all have bad days. We've all struggled with levels of anxiety or feeling sad. Maybe we're able to cope through it differently, and maybe we're not. So don't feel like embarrassed to talk about it, because the more that we talk about what's happened in our childhood or how that's impacted us or how we're feeling today, that allows somebody else to feel like they're not alone and maybe gives them the opportunity to access care for themselves and their families. And there is limited resources available for pediatrics solely because it is extra training. It's a level of specialization and comfort to be able to truly understand a child, to know how to relate to them, to speak to them. It's not about just sitting here and talking. We got to find ways to make them feel safe and comfortable, to make them feel excited. We've got to recognize that it's not just the patient, it's whoever is part of their circle of care and everything else that goes along with that. So it's supporting the family. And wait times are significant for mental health in pediatrics. And so for Kids Care, that is one thing that we're constantly evaluating and making sure that we have enough providers to ensure that these wait times are not the issue, accessibility is not the issue, and affordability is not the issue. And so again, the more that we put in benefits and we speak to these families about how they can utilize benefits, the better. The more proactive we are, the less reactive, which means the less therapy sessions there is. So the more affordable this is to fit in to a family's financial status. And we can't forget that we need to work together. So we have to know that there's levels of coordination that needs to happen when it comes to mental health with the public sector, the private sector, schools and communities, and other resource groups. And really, that's where pediatric providers thrive, is because we're so used to incorporating care plans that involve every single person that impacts this child life and where this child is going, to make sure that everything is joint and feels like this child feels like this transition and this care is solely individualized and unique to their needs throughout that process of the support that they need. And that may be lifelong. Next slide. There are current initiatives and solutions in place, and in Canada, they are really, from a national level, are trying to focus on improving access to resources. And again, focusing on that early access is important. So we need to, as a society, feel comfortable with government-funded programs as well as uninsured and private side of healthcare, because what that's going to do is it's going to allow the public side to have more access for people that don't necessarily have private coverage, and allow people with private coverage to access coverage. So in turn, that helps stressors on the hospitals and the more government-funded programs that are available, because we teach people how to use avenues that make sense to what they have available to them in terms of their resources through their benefits and their financials ability to afford this. And again, virtual is perfect. Children thrive in their place of comfort. No child will ever thrive in mental health supports in a hospital that looks nothing like where they live or feel safe. When a child is in crisis, of course, we need to keep them potentially safe in a hospital. But the reality is, if we prevent those crisis moments, the hospital should be very rarely used. And what should be done is that therapy in a home where a child is in their bedroom, or, could be sitting outside in their backyard, or at their family cottage, or maybe at their auntie's house where they feel safe, is huge to their success. Because what happens is, when families can access care, they they continue to use it. And so a traveling parent that is maybe away all the time, they don't seek the help for their child because they're always traveling. But if they're traveling and can log into that therapy appointment with their child, not only are they helping show that they're there supporting their child, they're making sure that that support happens for their child on a routine basis. It's working with their busy schedules, but it's also allowing them to learn as a parent how they can set their environment at home for the child when they're present. And so virtual is a huge spot that is growing in terms of pediatric mental health and mental health in general, and needs to continue to expand because this really is the best space overall for virtual care, because the follow through and the accessibility is huge from a family side, but also providers are wanting to provide care virtually because, like myself and other providers, we are parents and ourselves and trying to navigate busy schedules. So when we're able to give back time in odd hours that necessarily a standard business clinic hours would run, which then opens up more spots to provide care and give them work-life balance, which is why a lot of these providers are turning to provide care on virtual platforms like KicksCare. And again, we need to be proactive. Mental health and healthcare in general is meant to be proactive. So we need to intervene early, and we need to be able to recognize signs and symptoms and then put in strategies and supports as soon as we can, in terms of a child that maybe be showing speech language delay at an early age. That could be a detriment long way down in terms of their education, because that wasn't intervened at 18 months or 2 years. And so when we start being proactive in healthcare, we are less reactive. There's less severity and less duration of care that is needed. And in turn, we have this positive outcome of children that are receiving timely support that allows them to achieve their academic success and building these positive relationships and leading to a fulfilled life and a productive citizen in our society and a healthy and happy child. And again, building this coping and resilience that they need, because life isn't always easy and we're going to feel pressure regardless of where we're at in our life. And so we really do need to build resilient children and understand as parents and caregivers and employers what that takes and what access we need to provide to teach the people that are raising children what it takes to build resilient children with coping mechanisms. Next slide. So how we can make a difference, again, is raise awareness. Have campaigns in your businesses, have campaigns as an advisor, talk about it, have these conversations about mental health and how we all accept it, and we can all accept that each and every one of us are different, that our children matter to us because they're our future. And so the more that we promote and talk, the more people feel comfortable and the quicker they access care. And we need to advocate for change at all levels. So change in the school systems, changes in our workplace, changes in policies at the government level as well, because all of that affects. And we need to support families by making sure that we provide support systems, that we give them the resources that they need to be the caregiver at home so that they can come to work present, because their priority of their family has been taken care of, and you've been there to support that for them. Next slide. So to wrap this up, pediatric mental health is a growing concern in Canada, affecting millions of children and their families. And so we need to address this issue at many levels, and we need to involve education and the education system. We need to educate people about pediatric mental health. We need to do early interventions, and we need to improve access to care. And as employers, you are impacted, and you play play an important role in supporting employees and children. And when we provide right programs, that's when we are proactive, and then in turn, businesses and employers have better outcomes. And so prioritizing mental health in our healthcare systems, in our communities, and in our schools ensures that children are healthier and more resilient, and that continues for generations to come. So that is it for today, and I appreciate you listening to me for that extended period of time. And I guess I'll open it up to questions, but you can find more on KickScare's website, and you can email us if you have any questions or want to learn more about how you can support mental health, or maybe you're wondering about access for your family and accessing care.
Thank you so much, Ashton. That was incredible. You can really feel the passion when we're talking about this subject, and we think it's so crucial. And we already have a couple of questions coming through. So one of them being, there are children right now who are dependent or more dependent on things like screen time. And as you mentioned, that can have adverse effects on mental health. Are there any effective strategies on maybe reducing that screen time while still protecting a child's mental health, or any resources there that you could recommend?
Yeah, absolutely. So one of the is boundaries in the home. We know that children are going to be exposed at school because now technology is part of school. So when we're thinking about the amount of screen time a child has based on their age, we need to factor in the screen time that they have at home and at school. And then we need to set healthy boundaries and say why. Nobody ever wants to hear no because I said no. And I'll tell you, I'm guilty as a parent sometimes to do that. And then I'm a mean mommy. But the reality is what we need to do is say, we need to set these boundaries because it's not healthy for us or healthy for our brain to be on these electronics for this period of time. And it's always talking about our child in an age appropriate way that they understand, and saying 1 hour a day, when do you want? We're going to start this timer. When the timer goes off, we're going to take it away and we're going to put it here. And then tomorrow we get to have it back if that's what we're doing 1 hour a day. And then when a child is not responding well to that, maybe they're not ready for screen time at all. And we need to say, we've set these boundaries and expectations. You're very aware of them, but you're still struggling that. So until we're ready to hear that timer go off and put that away, we're not going to have that at all. And it's also mindful to go, I'm a working parent, I'm really busy, and today is a day that I have to throw a lot of rules out the window because this has to get done, or we're traveling, and that's okay. And don't hold that against you. What you need to recognize is this is exposure day in and day out to that level of, when children are on screen times for 4 and 5 and 6 hours. And when they're very young. Toddlers are meant to stay busy. Their growth and development milestones happen when they're touching and feeling and talking. When they're in screens, they're fixated in and looking, and their brain is just spinning. And so finding ways and setting up activities for them to thrive is important. There's lots of pediatric resources that are available. We have some on our website. Caring for Kids, which is a part of the Pediatric Society of Canada, has wonderful resources related to screen time per age group and strategies to do that. But really, it's about setting expectations and boundaries, and then following through regardless of the reaction of your child, and allowing yourself to have some leeway and forgiveness when life is busy and gets tough, and not feeling guilty that you may have to do a little bit more screen time here and there because you have to accomplish something, maybe for work or other children as learning.
Yeah, that's fantastic. Another question that's come through, with those who may have children that are not typically comfortable in group activities, for example, like sports. Is there any sort of unconventional team or group activities that you could recommend for children that are looking for something outside of maybe those more traditional routes?
Yeah, Group settings are amazing for children because what it does is teach them to socialize. And what I would say is that if there is a child that maybe is not as comfortable with group settings, I wouldn't just say put it to the wayside and never do it, because we do need children to integrate into social settings with others, but figuring out what that is that they love and their passion. So maybe this is a child that's not a hockey player or a soccer player, but this is a child who loves art and is creative. So you go to a place that has an art studio and you do art and there's other children around, and when they feel comfortable and they're doing something that they love and are passionate about it, they don't even recognize that they're in this social setting. And so even you go to the park and you play with a child, and maybe it's you're there for a little bit and then you step aside because you see them interacting with a child and you're like, this is great. And then next time they just run up to a child versus needing you there. And so you take those little baby steps with children that are more nervous in large group settings, but find their passion. Every child is going to have a passion, and every child needs to be exposed. Some children will fall into an activity because their parent has exposed them to it, and other children may need a little help along the way. Why don't we try basketball? Why don't we try karate? Maybe we do an art or a music class. Maybe we go swimming or to a public library, because that will still give them the social skills that they need. And eventually it takes one step to then get the next step and the next step. And we're there to encourage them and make them feel safe that they have us there. And eventually they'll run off on their own and be doing it. And if they're not and they withdraw, then let's figure out why. And maybe that's where a therapist is beneficial, because we can start teaching them strategies of when I'm feeling nervous like this because I'm in a social setting that makes me feel uncomfortable. What can I do to reassure myself I'm okay? Some of that is teaching children about self-talk. I have a daughter who kind of was anxious when she was young. I talked to her about saying to herself when she felt nervous and scared, I'm strong, I'm brave, and I'm confident. And now as a 7 turning 8-year-old girl, she tells me all the time when I'm feeling nervous and anxious, and these things still happen with her, she reminds herself that she is strong and brave and confident, and she can do that. And so sometimes we just have to understand what they're feeling, and children feel a lot of anxiety and worry in their belly. So know when they're saying, oh, I feel sick, oh, my belly. A lot of times it's anxiety and worry. It all goes to their belly. Some children throw up because of the level of anxiety. And so letting them go, okay, well, connecting what I'm feeling in here, I feel here. And what does that mean? And how can we work through that? And then that will make them successful in navigating other life challenges and getting out into larger social activities, one step at a time.